Hello everyone, welcome back to my YouTube channel. This is Rosette Charikunda, and today we are going to be talking about depression. So, what is depression? Depression is a serious medical illness that affects how one feels, how one acts. Yes, so that is briefly what I can talk about depression. Yes, so did you actually know that depression is the most commonest mental illness and it affects about 264 million people in the whole world? That is how serious it is. And the most funny part is that us women are the most affected. So, in other words, we need to really be vigilant in trying to really bring down this depression. Yes, and also it has like around 800,000 people who are suffering from depression have actually thought of committing suicide, and others have actually committed suicide. So that is how serious people are undergoing depression. Yes, and the good news is that depression is curable, and actually 80 to 90% of people respond well to treatment. That is the very good news that we have. So, how do you know that actually you're undergoing depression? So, we are going to be talking about actually the signs that will tell someone that I am undergoing depression. Yes, so most of the symptoms, someone feels sad all the time, someone has appetite issues. Some people actually their appetite increases and they grow fat. Other people they lose appetite and lose weight. Yes, other people they have sleep disturbances. Some may sleep too much, others may actually lack sleep. And you find they are really, really uncomfortable because of such changes. Yes, so some people actually feel very, very lonely, and some people feel like they're not loved. Yes, that is how serious it can really be. And some people they feel like they are worthless. They feel like they have no purpose to live. That is why they begin thinking of they should die. Yes, so some people actually have tendencies of thinking of committing suicide. So if you ever feel like you're thinking of committing suicide or you actually attempt it, so get to know that you're actually undergoing depression. Some people actually inflict pain on themselves. They begin cutting themselves, thinking maybe the pain they feel inside their hearts can be taken away if at all they hurt themselves, which is really wrong. Some people you find they are isolating themselves, they cut themselves from their friends, from their families, they close themselves inside like a room, they remove light, you find them in a dark corner, crying all the time. Even without anything disturbing them, you find them just crying out of nowhere. Actually, some people they even remain in those rooms. They don't shower. They're unkempt. Like they no longer want to take good care of themselves because they feel life has no meaning already. Yes. Sometimes some people think they really have no future. The future is not there, so why bother? Why yeah, they are always tired, drowsy. They feel like, this is the end of it all. But of course, it's not always the end of it all. We have a category of people who actually, when they listen to sad songs, sad music, maybe depending on what caused their depression, maybe if at all it was a relationship, something, maybe they broke up with a boyfriend or divorced with a husband, you find them listening to sad songs and maybe that is what they want to listen to. But really, really, depression is affecting a lot of people. Yes, so what causes depression? Yes, so I will say that there is no specific cause, but it like there are very many factors that come together and really make someone undergo depression, but most of them are maybe the social factors, psychological factors, and even biological factors. So we might find that there are some people who have genes in their bodies that at one point they will undergo depression, but majorly it is the normal life circumstances like breakups, you have been fired from your job, you've lost your job, you've lost your loved one. Yes, maybe you have no food, you have your kids, they are really crying, you're undergoing a certain okay, I will say hardships. Most of the hardships of life are the ones which really end up making people get depressed. Yes, and majorly, and more other things. Like someone feeling maybe certain disease condition, maybe someone has been diagnosed with cancer, someone has been told that you really have HIV. You know how some conditions can make you shrink, and oh my god, someone really says, I really can't take it anymore, and they really undergo depression. Yes, so if you've known that maybe you're undergoing depression, or you know someone who is really depressed, what do we do, or what can we actually do about it? So we have drugs that we can give, and of course counseling. Yeah, so what normally happens is that some people may be undergoing depression, but it is mild. They don't need to take drugs, but they can be counseled or talked to, and everything goes on well. Yes, then some people may have moderate or severe depression. So those are people who really need to, yes, they need to go to the hospital. They are started on medication, and yes, they can really do well when we get they undergo medication and counseling. Yes, so medications generally they give I will say antidepressant. So in other words, you're depressed, so they want to make you elevate, like become happy. So those are the drugs they give. I'll not go into details of them because they're in the hospital. So if I told you, you talk to someone or to a health worker and you find that you're actually undergoing severe depression, then you really need to visit the hospital. Yes. So the other part which I was talking about as counseling, majorly, what normally happens is that you can talk to someone. You know, sometimes if you have something that is really pressing onto you, and you get someone to talk to, you air it out. Sometimes you feel much better. Yes. Then you can also okay, you can talk to a person, or you can go to a group of people who have been undergoing depression. Then as people are giving their experiences, talking about themselves, you realize that actually what you're undergoing is sometimes something really small. So, and you see, maybe even if it is something huge, you see how they have been able to come out of such a situation. So it motivates you, and you're like, okay, I think I can also make it. And that is how people overcome depression. Yes. Sometimes we can try to do it by ourselves, and there are some things we can do that can improve the way our the body functions, and you find that you're actually overcoming your depression. And here you have to, like, doing exercises. Maybe you wake up in the morning and you go jogging, go to the gym, work out. So in that case your body becomes active, and the other feeling of tiredness goes away. You feel energetic, and it can really be of great help and great importance in overcoming depression. Yes, also I'll not forget to talk about good feeding. Yes, you need to feed well, balance diet, take some fruits, drink some juice. Yes, you can even take yourself out, you know. So there are some things we can really do to make us become happy, overcome our own problems. Yes, so That is basically what I can talk about. If you feel you what have the signs I've talked about, like you're having some or you're undergoing any form of depression, please at least start by yourself. Begin working out, feed well. You can get a friend you trust, talk to them. If you know if there is a hospital nearby, you can go visit a health worker or a doctor, that they can come to know how severe your depression is, so that they can take a good course of action. Thank you very much for listening to me. Tomorrow we are going to be talking about suicide. Yes, so thank you for listening to me, and please come to my YouTube channel, subscribe, follow this series, and you will be notified every time I upload a video. I love you all. Bye bye. See you tomorrow.